Hello, it's me, Tinnitus. I'm still here. Nah, just joking. Here I'm back. My name is Frida, your tinnitus coach, and today in this video I have a very, very cool podcast interview that I released on my podcast this week as well in video format. The guest on my podcast was Dr. Ben Thompson from Treble Health, a institution in tinnitus management in the US. But before we get into the episode and the whole interview with Dr. Ben, covering all different concepts from science-based approaches to tinnitus management, such as sound therapy, tinnitus retraining, cognitive behavior therapy, and many other things, I want to show you a little bit about something that I do, or that we do, for Tinnitus Relief. So just give me 20 seconds of your time and I will take you into our little tinnitus club. What is super, super important for us is that we have meetups every single week. So we have a coaching session. Yesterday we had a coaching session, and next week we're starting with patients in the habituation process, how patients can actually help you achieve habituation quicker through the back door. So it's a little bit like swimming. The more you try to swim when you can't swim, the more you're going to drown. And the more you let yourself float and take it slow in the process, the easier it is for you to be able to learn to swim. And habituation is absolutely the same. So if you are looking for a place to learn all of this, then there is, for example, this whole community with an 8 weeks guided course on using all of these scientific tools and helping you to get habituated quicker. And then you will be able to join our weekly coaching sessions and meet a lot of other people there who have fun together in learning how to do all of this, and to also suffer together and to legitimize that tinnitus is different and difficult. But thank you very much for tuning into that. If you are interested in that, you can visit www.mytinnitus.club for a 7-day free trial. If you don't like it, if it's not helpful for you, we have a 30-day money-back guarantee, which I've never had to give, really. But yeah, thank you very much for being on my channel. I hope that this video is really useful and helpful for you, and enjoy the interview I did with Dr. Ben Thompson from Treble Health. Thank you and enjoy. So hello and welcome back to the Outering Tinnitus podcast. This is Frida and I'm your host, and this podcast is all about the tinnitus science and how to get real and lasting relief from the ringing, buzzing, hissing, or whatever your tinnitus does. I'm very, very glad and happy to be joined here by a guest who was previously on the podcast. We have Dr. Ben from the US today with us. He was a guest on this podcast already many episodes ago, but we're very happy and glad that he is back and joined us for our show today. Dr. Ben, great to have you with us today. Please introduce yourself again to our audience, and yeah, let's get started with this episode.
Thank you, Frieder. Yeah, my name is Dr. Ben Thompson, audiologist, and thank you for what you do for the tinnitus community, Frieder. I'm glad to be here on your podcast, which I've been following for years. Essentially, I'm a doctor of audiology that specializes in tinnitus, and I completed my residency program at UCSF Medical Center in San Francisco, California, studied under one of the best tinnitus practitioners or audiologists in the state of California, and then went on to study under Dr. Paul Jastroboff, founder of Tinnitus Retraining Therapy. I created a YouTube channel and have made hundreds of videos which have garnered over 20 million views. Along the same timeline, created a telehealth service for patients with tinnitus, and we provide tinnitus treatment online with a combination of sound therapy devices and one-on-one professional counseling and coaching. So the main message I'm here to share today is about the importance of an accurate diagnosis of the root cause of tinnitus and how to treat it. With our team at Treble Health, which is the telehealth company that we have, we've seen over 1,500 patients through our comprehensive program. So we have a lot of data to share and a lot of knowledge that hopefully anyone listening here can get some practical tips to help with their tinnitus diagnosis and effective treatment.
Wow, yeah, that's a big story to share. A lot has happened since we recorded the first episode. So 20 million views later, a massive YouTube channel, a big telehealth company. Very exciting stuff that you're sharing with us today. And I hope that we get also a little bit more into the treatment approaches and into different philosophies, because I know already from the start and from the get-go that there might be a little bit of different viewpoints on different ideas, but that's absolutely okay, I think, because in the end, this is the one additional thing that I wanted to maybe say. Of course, as you say, the diagnosis is super important, but it is also very important that the diagnosis is accurate, because, of course, there are so many individuals with tinnitus, but there are so many individual cases of tinnitus as well, right? I think Dr. Golenhofen here from Germany said it in the podcast interviews that he did with you, but also with me. If you have seen one tinnitus patient, you have seen one tinnitus patient, and similar things can help, yes, but it is obviously very crucial that we have first a very clear diagnosis, and then afterwards a very clear individual treatment plan. Yeah.
Yeah, and Frieder, the problem in the United States, at least, is that the average tinnitus patient goes to an ENT doctor, and the doctor determines there's no medication or surgery to help the patient. So they tell the patient something like, sorry, you have tinnitus, there's not much I can do for you, or there's not much you can do about it, or even worse, sorry, there's no cure, you're stuck with it, you have to just manage it. And that can actually elicit, as you know, this stress, anxiety, negative feedback loop, making tinnitus worse and sending someone's brain into this fear, fight or flight response where they can honestly get stuck in for a period of weeks or even months. So it is a serious problem that we need to educate doctors and individuals about what is tinnitus, what exactly should happen with the diagnosis, and what are the viable evidence-based treatment strategies.
Yeah, absolutely agreed. So maybe we start from the start basically. My idea and my first question to you is basically, if we have an accurate diagnosis of tinnitus, what are the first steps to ascertain that diagnosis, basically? So if the ENT says there's not much we can do, I can tell you my perspective afterwards, but from your perspective, what are the first steps? What do people first do when they come to your clinic or to your telehealth clinic? And what are the first steps that you guys take?
Great question. I believe the first step for most patients is to get a hearing test and have the ears medically evaluated or looked at. And that rules out simple things like earwax, ear infections, severe hearing loss, etc. Research has shown that 90% of people with tinnitus have some degree of hearing loss. So to determine that, we need to measure your hearing, and that's where a hearing test comes in. I would say the most important step in the early stages of tinnitus is understand, number one, is there a hearing loss? Are we treating just tinnitus by itself, or are we treating tinnitus with the consideration that the patient has a hearing loss? Oftentimes the low-hanging fruit for tinnitus treatment, or the easy opportunity to get the quickest gains, is by treating hearing loss. So that's what we want to look at first. Frieder, what's your hearing status? I'm curious how your hearing is doing these days. I know I've learned about it in the past, but wanted to bring your case into it a bit.
Yeah, thanks, man. Yeah, you and most of the listeners know that I was born deaf on my left ear. My mom had an infection during pregnancy, and therefore my left ear has never really worked. And my right ear basically stopped working as well when I was clubbing a lot. So since 19, for 15 years now, I have a tinnitus that progressively got worse as well. And I also wear a hearing aid, and I have a funny combination I can show you. But now this is a hearing aid from a German audiologist, where we fit a little bit of a different yeah, you not a dome anymore, but literally like a closed. Yeah, I'm not really sure how to describe it in English, to be honest, but a closed. Yeah, a custom ear mold. There we go. Exactly, and that is something where from an audiological perspective, I know that there's also differences in what people get to their patients. There's these two schools of thought I have learned now here in Germany, that the one school of thought is not to overwhelm the patient and just to try to, do like the lowest gains that are not hurting them yet. But when I first got used to this new hearing aid and to the new level, then for me it was right at the edge of being uncomfortably loud. And I remember that I got, after this new fitting, which now is my baseline, I got into my car and I put the seatbelt into the seatbelt holder, and the click was so loud that I took the hearing aid out. And now this is my baseline. This is the normal everyday I have. And that I think has helped me a lot. But in the end, I do fully agree that you say the biggest gains for someone with maybe some mild to moderate hearing loss in the higher frequencies, and that might be also where their tinnitus is coming from, or might at least be exacerbating it. That brings a very big portion of the piece already in. However, yes, of course, then afterwards, and this is what I sort of like very quickly say, because I know I'm not an audiologist and I'm not a medical doctor. So when I see patients, I tell them, of course, the most important thing is to get evaluated by a doctor or audiologist or a doctor of audiology, which you guys have in the US. We in Europe, we don't have that here. And then to go on to dealing with, which is the second aspect, which I would like to ask you about as well, to really work with the emotional problems that come with tinnitus. So most people really have sleeplessness, they have insomnia related to tinnitus, they experience constant anxiety, they're in this constant loop of fight or flight. And this is really where I base me and my coaching as well as our online club on. But how do you guys address that second part of tinnitus within your telehealth clinic?
Yeah, thank you. Well, I'll first go back to the principles of tinnitus retraining therapy. And what's fascinating is that over the last years, I've interviewed most of the prominent researchers in the tinnitus and audiology space, spanning from the United States to Europe. Some of the researchers that wrote my textbooks when I was in audiology school. And speaking to them, a lot of the fundamental knowledge of tinnitus treatment in the last 20, 25 years comes from Dr. Jastreboff's research into what is the model of tinnitus, which essentially found that there's a sound component and there's a mental and emotional component to bothersome tinnitus. And it sounds simple, and maybe most people would agree with that today, but speaking with all of these experts that have been in the field for many decades, it was clear that that research was an important part in setting the future for tinnitus treatment and basically how professionals would take care of the patients. To answer your question, if we look at tinnitus treatment, there's two main components. One is the sound treatment, of which you had shown your hearing device, right? So that's the sound treatment, and hearing aids can be part of that, as well as sound therapy and some other forms, but the sound treatment is an important pillar to retrain the brain and lower the tinnitus over time. The other important pillar, just as important, according to this model, which is referred to as the neurophysiological model of tinnitus, the other important pillar, the same level of importance, is the pathway through the mental and emotional system. If someone has significant tinnitus, but they've trained their amygdala, the emotional response, the hyper attention on tinnitus, if they train that part to be very, very low, then tinnitus is less of a problem in their life. They can do things like they can read a book on a couch in a quiet room. They can go to sleep in the evening without the constant ringing keeping them up at night. They can concentrate and work on their computer during the day without needing a bunch of noise in the background. So both of these pillars are really important, and the mental emotional pathway, essentially what we're doing here is we're changing the filter mechanism of the brain, which can reduce our awareness of sound. And this is referred to as habituation. And even though it's pretty well agreed, so even though it's agreed upon now, just a few decades ago, we didn't have this model of using habituation for tinnitus. Patients were just told, hey, you have to, occasionally use sound masking, and that's all we have. But in more recent decades and years, we have psychological based models for how to help tinnitus, and then we have more comprehensive programs which include the psychological element plus the sound treatment.
I 100% agree, and I've come across this principle. Listeners will know it. They might even get bored with it already when I come back to Pavlov's dogs and conditioning. When you train the dog to, when he's being fed, you ring a bell, and then you start ringing the bell, the dog starts to salivate even though you're not giving him food. So that's basically, in a very, very simple terms, if people are interested, they can Google Pavlov and Pavlov's conditioning. Similar thing that happens to you in your tinnitus, whereby sort of like the food and the bell are your tinnitus and your emotional or your physiological reaction caused by the limbic system and the amygdala within the brain, which are the two centers, just for a very brief explanation, who are responsible for your fight or flight or your freeze reaction inside your brain. And of course, since tinnitus often is very bothersome, right? It is something new that we're not used to. It is a new thing in our body. Often, like, also a new ache or a new pain is, something that we're first afraid of. We go to the doctor says, no, it's fine. Take some paracetamol, some ibuprofen or something. You'll be fine. It's going to be gone. But with tinnitus, it is something new, something that we've never heard before. Maybe then we Google it, we read negative stories on the internet, and then of course this whole mechanism is incited. And this fight or flight, this anxiety leading to insomnia, leading to, you get drained, your energy is gone. And then of course that leads to further research. How can I get rid of this? And so on and so forth. The ENT tells you can't. And all of this creates, within just days or weeks, creates this massive turmoil of conditioning of how terrible tinnitus is, and your life is basically ruined. So I totally see that as, first and foremost, one of the biggest obstacles, with, of course, on the side, people always having adequate, not only tools to listen and hear better, but also adequate tools to know how to prevent future hearing loss better. Because that we live in very, very high noise societies. We constantly are used to this cool gadget of our AirPods in. I think that probably, if you agree, most people with tinnitus now know the safety features within Apple and Android for lowering the decibel output volumes, but probably before they didn't. So that's another factor. So ultimately, my opinion is that if we have this model to help people understand of what this physiological reaction to tinnitus is like, meaning that I can understand that this high anxiety, high stress hormone reaction is something that I can retrain my brain, because I can also retrain my brain to, for example, live close to an airport and sleep at night, even though airplanes are crossing, right? So, and we can do the exact same thing with tinnitus. And people know that, they start to understand that, and unfortunately often after really a month of suffering, they understand that there must be a different solution than core tea, ear drops, or some other herbal remedies, or some of these ideas. So I'd be curious a little bit more to touch on 2 points. I will say this now because I think this is a very interesting topic, and people out of my community and coaching clients have asked me. The sound therapy aspect, I know, is a very prominent and very important part for you. I will tell you my opinion a little bit later, but because I first want to hear from you from a sound therapy perspective, why is it so beneficial for tinnitus?
For someone who has bothersome tinnitus, the brain is categorizing it as something important, something that's a threat, something potentially dangerous, something to pay attention to. Sound therapy is one of the most successful tools when used consistently in a treatment period, that if you present a sound, let's take white noise as an example. If you present white noise at a level that's softer than your tinnitus, what you're doing is you are showing the brain that a constant sound is actually neutral. It's not threatening. It's not causing harm. It's not a real danger. So we're impressing upon the brain that this false alarm of tinnitus is a false alarm. It's not a real alarm. So the consistent sound over typically between 6 and 12 months for someone going through a significant treatment with tinnitus, that sound is played underneath the tinnitus during the treatment period, and over that time, patients have better success with reducing their baseline level of tinnitus. So by the end of it, they don't need to use sound therapy anymore, and their baseline tinnitus is often lower. We can measure that with the awareness of tinnitus. What percentage of waking hours are you aware of the sound? We can also measure that with the subjective volume from 1 to 10. Most commonly, patients would start in our program, let's say around a 6, and then after a treatment period, they would explain, oh, my tinnitus is about 50% better. They may say now it's a 2 or a 3. So sound therapy is one of the tools that promotes neuroplasticity. Tinnitus is often neurological, therefore brain plasticity can happen, and sound therapy is one of the most effective methods and historically proven methods to work for patients. And that's different than masking, where you completely cover your tinnitus. And for those who are trying to learn the details, there are some nuances. So completely covering your tinnitus is not what we're doing. Using it just to distract yourself so you can, quote, forget about the sound, that's not what we're doing. We're trying to promote this neuroplastic change of the auditory brain, which over time can reduce the tinnitus, and that helps people get back to living their life. So that's the overall summary.
Yeah. And I know the theory quite well, and I do know that also for a large part of the population it is and can be quite beneficial. Of course, I only get the people for whom it did not work as well, but that is normal, right? In every medical treatment, you have people that it works, that the traditional approach works very well, and then you also have people where the success rates are maybe not as high. And my personal opinion is I think people often they roll from controlled sound therapy into masking, and they you get stuck even after the treatment plan. You get stuck on using sound in your everyday environment as a means to control your sound environment, not to be paying a constant attention to your tinnitus. So I do agree that for a treatment plan or for a part of time within a treatment plan, sound therapy can be beneficial. I tell the people, the other week I had a new member join our club community, and she asked me, well, I heard that you are not the biggest fan of sound therapy, so should I stop doing this now? Should I stop? And I'm like, no, of course not. So whatever helps you. And if you want to make the steps of transitioning, and she mentioned to me that she's been using sound therapy for 2.5 years. And then I said to her, the problem is where you get stuck on constantly needing another soundscape to cover the thoughts and emotions that you're having as a response to your tinnitus. And I do fully believe that within a controlled period of time, sound therapy can help people sleep better, can help them concentrate better at work, and to help them, get this immediate or first stress level cortisol and adrenaline down at the start. In the long run, however, what I often see with patients or people that I work with is that in the long run, it keeps the attention, of course, away from the negative thoughts and emotions that you have towards your tinnitus. But it is also a problem that what if your battery suddenly dies? Or what if you are somewhere where your favorite playlist is not accessible because of Wi-Fi issues or something? Then I see high distress in the people, and what the high distress is not the tinnitus sound anymore, but it is the reaction to the sound, the emotional and physiological reaction. And if what I say, and what my opinion there is, if we go from an acceptance and commitment therapy perspective, which is an extension of cognitive behavior therapy or an addition to the cognitive behavior therapy model, is that we work with the thoughts and emotions and validating those, but while still working towards value-guided actions in life and retraining the brain in that way towards habituation. So I just wanted to clarify that I'm absolutely not against sound therapy, but I also say that we have to be very wary that people after the treatment time ends still turn to sound therapy or rather masking, and then still deal with the emotional aspects of tinnitus and not having had the right the right results within their treatment plan in that time.
Yeah. So In 2022, there was a large-scale randomized study with 151 participants published by the Tinnitus Retraining Therapy Trial Group. And essentially, it was measuring the effectiveness of tinnitus retraining therapy, which combines the sound therapy plus that emotional mental counseling piece. And what the study found was that um, those who had the sound therapy plus the guided counseling from a professional, that led to the best improvement in outcomes. That was better than just counseling alone. That was better than just sound therapy alone. So I think it's common for people to think, oh my God, should I do sound therapy or should I do CBT or should I do meditation? What should I do? And the answer is often multiple tools at the same time. It's a holistic, comprehensive approach. And that's what the research shows. And you know, it's really important to highlight that sound therapy can change the brain's reaction and response to tinnitus. So I wanted to highlight there were two studies that I found very interesting from Chen et al. In 2022 and Han et al. In 2020. And individually, those each showed that undergoing sound therapy, sort of pre and post, measuring the brain with functional MRI imaging, MRIs, what they found was that people who had significant tinnitus that went through sound therapy at the end of the treatment, the parts of the brain, relevant regions like the frontal lobe, the auditory cortex, etc., the emotional centers of the brain, that those were restored to near normal levels or normal levels for these patients. So this is not just, oh, I'm distracting myself and trying to forget it. This is really, I'm changing the brain so that tinnitus is less. And to your specific point, Frieder, there's no medical treatment that's 100% effective. So for tinnitus, it's true that a lot of people are still struggling with tinnitus, right? Not everyone has a massive success story. So what that means is that for someone going through a professional tinnitus treatment, for example, with the data that we measured with our patients at Treble Health, we have an 85% success rate, meaning a clinical significant reduction of tinnitus of at least 13 points on the TFI, the Tinnitus Functional Index. That's the best practice, the best way to measure tinnitus. So if 85% of people are getting better within 6 months, well, what about the other 15%? Yeah, there are some challenging tinnitus cases. So it makes sense that some people would naturally have to use sound therapy longer. But for those specific cases that you mentioned, my thought goes to what was that person doing during the 2 years where you said that they were using sound therapy? Because if that was my patient, I would want to make sure they're doing all the other things, including assessing what is the root cause of their tinnitus. Is it related to hearing loss? Is it related to stress in the central nervous system? Is it related to something somatic or somatosensory, like physical movements of their jaw, their neck, posture, or musculoskeletal issues? So it's important for everyone listening to recognize that while we can give general advice, it is very important to have an individualized assessment and treatment for your individual case.
Absolutely. And yeah, just to pick up exactly where you left off, often it's a combination of all of these things, right? Uh, I've heard few people who said, no, I don't have neck and back issues, or highly stressful environment at work, etc. I don't grind my teeth. Yeah, there of course there are management protocols, and we all know that from a chiropractic or physiotherapeutic practice. But often these are management strategies, right? I think people often mistake it for relief or cure strategies. So if people say, like, if I manage to, get my trigger points right, or get the neck and back right, then yes, okay, there are a handful of people who manage to get full relief from tinnitus through doing that, where the tinnitus is purely somatic. But there are probably more people where the somatic part of tinnitus is an exacerbator, but not the only culprit, right? And we all know that there is still a lot of research to be done, and we all know that there are some promising tools, including hearing restoration, etc. But I do agree that it has to be a very individual approach. And I, for my part, try to make sure that people have gone through all the necessary medical treatments and audiological practices before starting the work of, we have a case of where the thoughts and the anxiety around the tinnitus that never end are the bigger problem, rather than the audiological treatment or the somatic treatment of that tinnitus. And that really is where from the start I have understood where we come in, and where I do my coaching, and where we have the community practice, and where we sort of start using acceptance and commitment therapy as well, which you surely know is used for depression, anxiety disorders. Even there was a very, very cool study that Russ Harris and his colleagues did in refugee camps, where they instructed people to acceptance and commitment therapy, and found a severe reduction of what they were going through. And for tinnitus, it is quite effective as well. And I do believe, though, and I think this should be the core message of what we've been talking about, everyone should get an individual treatment plan, and should, of course, get all the necessary steps taken to see what the tinnitus is like, where it might be coming from, and what the necessary treatment options could look like. Yeah.
Yeah, so for those who could benefit from that emotional or mental support, really what we're talking about here is more psychological based interventions. And there was a 2020 systematic review of cognitive behavioral therapy for tinnitus from Landry et al. And what it found was that working one-on-one with a professional for CBT, that psychological based approach, that it significantly reduced tinnitus related distress. And there was not as clear of a benefit when someone did self-guided exercises. So there's something here that tinnitus can be better managed and potentially reduce in volume and intensity when we have structured accountability with a professional trained in these methods. So I like to bring in the research here to support that, there are evidence-based strategies that do help most people with tinnitus. And I don't know about you, Frieder, but for me, it's unfortunate when people come to me and they say things like, "I've tried everything," and I hear them and I'm thinking, no, you haven't. You haven't tried everything. Frankly, you haven't even tried the most evidence-based tools. You haven't tried tinnitus retraining therapy. You haven't tried cognitive behavioral therapy. So don't tell me that you've tried everything. Of course, that's more of my internal dialogue. I'm a little more compassionate and empathetic when I'm speaking to them. But it's frustrating to me when someone is in the place where they feel like they've tried everything. In reality, they haven't tried the thing that's most likely to help them, in my perspective. I'm not sure if you come across that in your work.
Yeah. But I absolutely understand what you say. And I want to point back to the fact that probably I would have been one of those 15 years back. I would have probably been one of those. I've tried everything. I've cut out sugar. I've done more exercising. I've watched my eating, and so on and so forth, and nothing has really worked. And I can fully understand where people are coming from, right? I fully get that as well. What you said, that you think, this is the 100th patient who now says he's tried everything, but you see that, he gets up in the morning and he said, if my tinnitus is this loud today, I won't be doing X, Y, Z. I can't go here and there. And we all know where that leads. It leads to isolation, it leads to not doing your life anymore, and it leads towards depression and not towards tinnitus habituation, of showing your brain that you can do everything you set yourself out to do, regardless of whether your tinnitus is present or not, which is a really important thing to show your brain, right? Which leads to, as you say as well, the neuroplastic changes in your brain saying, okay, tinnitus is maybe not as dangerous as we thought. However, I do often understand, and I think you're fully right, that we have to be very compassionate with these people, that, there are so many people out there struggling, and there are still probably more resources, despite your 20 million views and hundreds of YouTube videos that you have. There are still more resources and forums out there where people go with this negative flow of tinnitus information, where they get very caught up in their own anxiety and emotional spiraling, that it is very, very easy to, first of all, want to get some relief. And you want to tell the person that you're across that my suffering is really, really bad. So I want you to hear me out. And, of course, it's an offer to you as on the other side, that you tell them, no, we got you. And this is also sort of like what we do, right? Of course, there's a lot of evidence-based stuff and, sound therapy and CBT and, for me, acceptance and commitment therapy. But in the end, what we also want, we forget when we go to our doctors, we want someone who's sitting there with compassion saying, like, I got you. And, maybe you have tried X, Y, Z, but we still have this, and this, and here's why it's going to work for you. And we know that is another part in tinnitus therapy, or in any medical therapy, right? We know it from antidepressants to anything else. I'm currently, for the first time in my life, taking some antidepressants, and I'm not shy to talk about it. But I know that it also works because I believe that it is helping me right now. So I also need to establish a sense of trust, a sense of calm, and tell the person, like, all right, I really understand where you're coming from. We can talk about all those thoughts that you have around your tinnitus, all those emotions that make you feel terrible. I absolutely get it. I've been there as well. I know you have tinnitus as well, so you might have also been there. So we are here, we understand you, and you have done this, but we have some few alternatives for you, and they will work for you. And if that doesn't work, we still have a few other things to try out. And I think that's a very, very important point to make, yeah.
Absolutely. Anyone who specializes in tinnitus, in my opinion, is empathetic. They choose this field because they want to help people. They see people who are really suffering, and they learn a way to help them to relieve their suffering and to provide a more true, bright, healthy, happy future, really. So totally hear you. And for anyone who's listening that is in a hard place, just know that there are people who are here to help, and there are other people like you who have even been in a worse situation who get better. You don't need to completely cure and eliminate this in order to turn things around. So it's an important message to share.
I like that a lot. That's very good. Ben, I wanted to ask you one thing. So if people are listening to this and they are struggling and they have a big difficulty, what is an easy step to, find some resources, find some relief, find something online that is pointing towards your resources? I know that I always put some in the show notes as well. So guide some people towards what you guys do for Tinnitus Relief.
Yeah, for individuals who live in the United States who want a comprehensive treatment program, tinnitus retraining therapy, the fundamentals of cognitive behavioral therapy. I've personally hired a team of excellent doctors on our team at Treble Health, and you can find us at treblehealth.com. You can book a free call with us to discuss your specific case. We do provide a root cause ID where we assess the various root causes that can be contributing to your condition and recommend a treatment plan accordingly. Most of the treatment we do provide via telehealth. Occasionally, we will refer to another medical specialist for some diagnostic testing or specific kinds of treatment. So definitely reach out to us, and yeah, thanks for the offer.
Yeah, absolutely. I mean, I've always been looking up to you also from a YouTube perspective. I think you do fantastic work. And, when I was 19 and I had this big difficulty and there was a lot of shame involved, because I damaged my one remaining good ear, and that was a very difficult time for me. So not really having many resources out there. I remember listening to some ASMR videos and stuff like that to calm me down, and this was kind of like my treatment approach back then. I think there's a world of difference, so it is really, really important that we have people like you who've devoted so much time to the YouTube game, who've cracked the YouTube algorithm to get to a place where people consume valid and valuable information from your channel, where everything is science backed, and someone who's been in this industry and this field for such a long time. And then there are, of course, people like myself, where I'm a little bit more in the community aspect of having gone through this myself, of having the struggles, and of having worked with a lot of people also one-on-one, but not having not having the specific treatment backgrounds, where I refer people more to practitioners in their home countries, where we basically take people in our online community from all over the world. But of course, people should always complete and do their local treatment with their practitioners. Yeah. So thanks for sharing that.
Hey, we need all of it. We need all of it. There's a lot of people that really need help. There's a lot of disappointment from the medical community regarding tinnitus for our patients. So we need you, we need me, we need many others to really make a difference. And that's what we're trying to do.
Awesome. Ben, I think we can wrap this up. It was a pleasure to have you on the podcast today. Is there something, a last statement, some last words for the listeners out there that you want to give to them today on the second episode having you on the show here?
Absolutely. What I've learned over the years is that tinnitus can improve much more than people think. And as I go deeper and deeper into my profession, I am amazed at how people can turn their tinnitus around, even when some other doctors might say there's not much you can do or it's permanent. In reality, majority of times things can get significantly better. So if I can change anyone's belief on my tinnitus won't get better, things are kind of stuck where they are, I would just ask someone to be open to considering that that might not be true. And if that might not be true, then what can you do as an individual to maybe get 10% better in the next few months, maybe 30% better in the next few months? That's the kind of strategy that gets people into a better place with tinnitus. Compare that to what most people currently do, which is kind of believe that where they're at is where they're going to be, and there's not much out there that can help them. So that's my message, and I just hope everyone stays healthy, takes care of themselves, gets good sleep, feels better in their body, in their ears, and related to tinnitus, as well as hearing conditions like sound sensitivity, hyperacusis, and hearing loss as well. So, Frieder, I really appreciate the invite, and it's good to catch up with you. I hope to talk to you soon.
Yeah, thanks, Ben. And we'll surely have you back on the podcast in the future. Thank you very much. And until next time. Thanks. Yeah, thanks again for watching this video, the interview with Dr. Ben Thompson from Treble Health. I hope it was very insightful and useful for you. We have a lot of other videos on this channel here where I explain to you how the concept of habituation can be achieved through practicing, for example, acceptance and commitment therapy. And if you're looking for more than just sound therapy, or in addition to your habituation process that is supported by a community and people who understand what you're going through, then again, I just warmly invite you for a 7-day free trial at www.mytinnitus.club. Other than that, subscribe if you want to have all the other videos that are coming out. I'm talking about an emergency sets and approach to tinnitus in my next video, as well as talking about patients in the habituation process, which is also topic month inside the club this year. So there will also be links in the resources below where you can find free resources, but also access to my coaching program. Right now, I am giving you the ability to inscribe yourself in our coaching waitlist, and you can find that all in the links to this episode below the video. So thank you very much for tuning in. Thank you very much for being here. And from my heart to yours, I hope that this has been useful and insightful for you. I'm here because I know where you are. I'm deaf in one ear and have tinnitus and hearing aid in another. And I know what you're going through, so I absolutely feel with you. And yeah, I hope that this has been able to get you some relief, and see you in the next one. Goodbye.